waking up with us this morning. There's new information linking sleep deprivation to other health issues, specifically in women. Joining us today is Dr. Stanley Wang from the Heart Hospital of Austin to help explain. Thanks so much for joining us this morning.
Thanks so much for having me here.
Talk about what this study shows.
Well, there have actually been a series of studies that link sleep disorders with heart disease, specifically one called sleep apnea. That's a condition where you stop breathing in your sleep, and when the heart tries to pump blood to the lungs to get oxygen and the lungs aren't breathing, that causes a lot of strain. But what it does is it triples your risk of having a heart attack or angina. It can triple your risk of having high blood pressure, which it in turn causes strokes and heart attacks. It can double your risk for dangerous cardiac arrhythmias like atrial fibrillation. So it's a very underappreciated cause of heart disease.
So it's similar to high cholesterol or stress-related disorders that can lead to heart disease. And when we're talking about sleep deprivation, what are we talking about? 2 hours, 6 hours?
The average adult needs 7 to 9 hours of sleep, and most of us don't actually get that ideal amount. And so even sleep deprivation or insomnia itself can lead to high blood pressure, which leads to heart problems. But if you also have sleep apnea on top of that, that causes even worse problems. But the good news is that we're now able to diagnose and treat this very effectively. We have a very unique facility here in Austin. The Heart Hospital of Austin is the only heart hospital in Texas that has a truly integrated sleep program. It's the Sleep Disorder Center that's run by cardiologists that are also board-certified sleep specialists. And with this level of expertise, we're able to very effectively diagnose and treat not only the sleep problems, but also the heart problems that are related to it.
How do you diagnose the problem, and then how do you treat it?
Well, in general, the diagnosis requires an overnight sleep study where the patient comes in, they spend a night in the hospital. It's usually a very nice facility. The rooms are much nicer than typical hospital rooms. They look more like hotel rooms. But we gather a real gold mine of information, anything from the brain patterns to the heart EKGs. We measure oxygen levels, and we learn a lot about the patient's sleeping and breathing patterns, as well as their heart problems. There have been many times where we've diagnosed actual heart arrhythmias in the course of a sleep study. And if that shows that the person has sleep apnea and they're likely to benefit from it, the treatment is usually with an air pressure device. It's a little mask that you wear at night. It helps you breathe throughout the night, and it's been shown to ameliorate all the risks that are associated with sleep apnea in relation to heart attacks and heart failure and high blood pressure.
And there's also something called the simple sleep test. What is that?
There are a couple of different types of simple sleep tests. One is a simple survey that people can fill out, and by using the survey answers and measurement of things like the neck size and the body size, you can kind of guess at whether the person has sleep apnea. There's also a home sleep test that you wear. It's kind of like a helmet that you wear for a couple nights at home. And those are pretty good, but the gold standard is still kind of the attended overnight sleep study in the hospital.
Wonderful. Dr. Stanley Wang from the Heart Hospital of Austin, linking sleep deprivation to other heart disease. Thank you so much for being with us.